Ani was referred to therapy by the court as part of a rehabilitation program. He is serving time in prison, having been convicted of grand fraud. The scam perpetrated by him involved hundreds of retired men and women in a dozen states over a period of 3 years. All his victims lost their life savings and suffered grievous and life-threatening stress symptoms. He seems rather peeved at having to attend the sessions, but tries to hide his displeasure by claiming to be eager to heal. 3 of his victims died of heart attacks as a direct result of his misdeeds. He barely suppresses an urge to laugh out loud and then denies any responsibility. He rationalized his crimes by claiming they all would have become filthy rich. I am here today for the first time ever with a psychologist that can give us an explanation for Ani's awful actions. Joining us today.
Thank you for having me. It's my pleasure.
So do you know why Ani has done these awful things?
Yes. According to my diagnosis, I believe he has an antisocial personality disorder. Since he's a con artist and is avoiding responsibility and when questioned for his wrongdoings, he's rationalizing why he did it, and he has no remorse for the deaths he caused. He also is low in anxiety and was very antisocial as a child.
Now we are going to speak with one of Ani's doctors.
According to the tests, Ani has reduced activity in the frontal lobe and he shows little autonomic nervous system arousal. It has also been discovered that relatives of Ani show similar personality disorders.
I also want to add that a possible cause of his disorder would be that he's very unconcerned with social reward.
What types of psychotherapy do you recommend?
I definitely recommend the psychodynamic therapy technique to better understand his process of thinking. Recommend maybe a lifestyle change where instead of his fearlessness when he's doing these crimes, it would be replaced to being athletic. And however, I would definitely not recommend humanistic / client-centered therapy techniques, because that would be where I would exhibit empathy and make him very comfortable. The problem is he wouldn't be willing to, because he's definitely not empathetic and I don't think he'd care. I also don't recommend the cognitive therapy technique because it only works if his thoughts get in between events and reactions, and in this case it didn't really. And lastly, I don't recommend brain stimulation, specifically ECT. It's very effective for clients with severe depression, however, it's not proven to work with personality disorders.
It is important to know the 4 Ds of Ani's disorder. First, deviance, which means he has no empathy. He also brought distress to 3 of his victims who died of heart attacks. He is unable to function with others, and he has no remorse for his actions. What specific drugs would be most useful for treating this individual?
Any antipsychotic drugs would treat his severe thought disorder. Some examples would be risperidone and olanzapine.
What would be harmful about using these drugs?
Well, the patient could appear sluggish and you could have tremors and twitches, the effects similar to Parkinson's.